Lastly, feeling worse is worth discussing. It's important to acknowledge that discomfort is part of the process. Discomfort and feeling it is part of the productive process. If you never felt sore after a workout, it probably means that you're not building enough muscle, right? If you're not pushing yourself to the limit as an athlete, you're probably not going to get to the point that you want to get to. And the same principle goes for therapy. Discomfort is part of the process, and feeling overwhelmed but if you're feeling overwhelmed for several days, if you're unable to function, feeling emotionally unsafe, or noticing that therapy consistently leaves you without enough support, that's important to address with a therapist, because maybe you need to get connected with other support systems. Therapy should challenge you, but it should also feel collaborative and paced in a way that supports your well-being. So you might be asking, what can you do after therapy? Well, first things first, give yourself time to decompress. I like to tell clients that after a heavy session, maybe give yourself time to walk, to journal, to process the emotions. Give yourself some leeway afterwards. Journal about what stood out. Go for a walk, spend time outside, stay hydrated, eat something nourishing, and practice grounding techniques like mindfulness, meditation, prayer, whatever seems right to you in that moment. And remind yourself that difficult emotions don't always mean that something is wrong. Discomfort can be part of that process. And so feeling worse after therapy doesn't automatically mean that something isn't working. Sometimes emotional discomfort is part of processing experiences you've carried for a long time. And at the same time, if therapy consistently feels overwhelming, please speak to your therapist.